This is a video tutorial of the COVID-19 antibody test. As you see, here are the supplies you will need: a clean surface, the test cassette, pipette, lancet, buffer, alcohol swab, Band-Aid, gauze, and gloves. To begin, clean the middle finger with the alcohol swab. Allow to dry, and then prick the finger using the lancet at the corner tip. Once you have pricked the finger, collect the blood with the pipette. You will need to collect enough blood to be able to distribute 2 large drops of blood into each well of cassette. Apply gauze and Band-Aid to finger. Next, using the buffer container provided, distribute 2 large drops of buffer into each well of the cassette. Allow approximately 10 minutes or less. The test results will appear on the cassette. Results shown with line at IgG at C level show negative exposure or previous infection. Results shown with line IgG at C and T level shows previous exposure or past infection. Results shown with line IgM at C level shows negative results. Results shown with IgM C and T level shows current positive infection of COVID-19.